Hello, I'm Dr. Eric Goulder at the opening of the Heart Attack and Stroke Prevention Center of Central Ohio, and I'm here with Dr. Bradley Bale and Dr. Amy Deneen, who are the co-founders of the Bale-Deneen method, which is a method or process of looking for inflammation and genetic causes of atherosclerosis to prevent people from having heart attacks or strokes. I'm also here with Dr. Barbara McClatchy, who is in the Heart Attack and Stroke Prevention Center with me.
Excellent. Thank you, Dr. Goulder, and congratulations on your new center. And Dr. McClatchy, congratulations on everything that you all have established here at the center. Both Dr. Bale and I are really thrilled to be here.
We're glad to have you.
Well, thank you. I'm curious, what technologies have you brought in from a dental aspect that go above and beyond, if you will, the standard of care?
Well, we've been doing saliva testing here for the last 4 or 5 years, and it's become more important now that we've learned that the bacteria that live in your mouth can actually drive heart attack and stroke. So we've been getting great results doing our saliva testing, going through therapy, and post-testing we're realizing that we're making a big difference in our patients' health. We've also brought in the cone beam technology, which shows dental infections, whether they are symptomatic or asymptomatic. It shows airway, it shows sinuses, it shows calcifications in the carotid artery. So when we take the cone beam for one purpose, we get a volume of information that we weren't necessarily looking for, but realize that some of our patients really are not healthy. And we're able to put the story together in a personalized way and get them some help. With the help of Dr. Goulder, we can look at our patients from a medical as well as a dental standpoint and give them the overall health approach.
That is wonderful. That is wonderful.
Yeah, that's fantastic, Dr. McClatchy. That technology that you brought in here is superior, and I'm sure you're aware a recent study was published that showed your 3D cone beam is about 96% accurate finding infection in the teeth. And that's fantastic because regular radiography, what a lot of your colleagues are using, is only about 75% accurate. And you don't want to miss that kind of infection because it can trigger heart attacks. And then your salivary testing, you're able to find out if they have those high-risk periodontal pathogens through that saliva testing. And we now know that actually is a cause of arterial disease. So congratulations, and it's wonderful you have that type of technology in this clinic. It's going to help a lot of people.
Well, and dentistry is not used to having testing. You know, the medical profession has always had very objective testing to get markers of the status of our patient's health. And now introducing some actual objective testing in the dental arena gives us information. Let's say if I have to sign off for a dental clearance, if a patient is going to have artificial joint or open heart surgery and their physician is asking me to give a dental clearance, I no longer can just clean their teeth and say they're good for surgery. I have to take the saliva test approach and make sure that the infection in their mouth is not going to drive any inflammation through the body and have a result of problems with the surgery.
And I would just like to add too, that's a service you can offer to the surgeons in Central Ohio, correct?
Correct.
Patients that are undergoing an elective orthopedic surgery or something that really might compromise that patient's health, you could receive the referral to clear that patient, so the surgeon's liability definitely goes down from any post-surgical complications.
Correct.
That's a really unique service because you basically go above and beyond the traditional clearance and can really assure that surgeon that this patient is safe to undergo such an invasive surgery. So what a great service you're offering.
And I believe our patients appreciate it as well. They are learning more and more and are very supportive of the changes and the services that we offer here.
Yeah, it's fantastic because it is the pathogens, of course, the germs, the bacteria that drive the risk with arterial disease. It's not how deep the pocket is or how much bleeding they have or how loose the tooth is. And in the past, that's been the whole definition of periodontal disease. How deep are the pockets, etc. And now we realize what's critical to know are the pathogens, what bugs are there. And we also now know, correct me if I'm wrong, that you can have minimal clinical signs. So you don't have to have deep pockets. You don't have to have loose teeth. You don't have to have a lot of bleeding to harbor these very dangerous pathogens. And that's what you're uncovering in these patients with your salivary testing. You don't even have to have a blood test for it.
30 seconds swish, and you have the results back in a week.
That's amazing.
That's
It's amazing.
fantastic.
In medicine, we rely so heavily on clinical laboratory testing, and you touched on this. That's how we identify problems with the intention of correcting those problems so that the patient doesn't suffer an event. That's how we're trained, and that's how we specialize. Matter of fact, we consider it successful if our patient never feels the value of our work. And what you're doing is leading the whole charge in dentistry to embrace clinical laboratory testing, which is unique among the dental field. So you are without question a thought leader in the country, and the fact that you're bringing this to Central Ohio with Dr. Goulder as well to bring this to the Heart Attack and Stroke Prevention Center of Central Ohio is really terrific. So huge congratulations, and we are honored certainly to witness it. So thank you.
Yeah, you have the team in place to guarantee that people won't have heart attacks or strokes. So the people in Ohio should be thrilled that you've opened this center. What an opportunity for them. And also the healthcare providers that take care of those patients, because they're not immune to having heart attacks or strokes either. And they certainly need to be clients of yours as well. They'll enjoy the experience, they'll learn things, and they'll stay healthy themselves so they can keep taking wonderful care of their patients. It's a win-win-win situation, so we're really excited for you.
We're here to offer our services to any of the dental community that maybe don't have the technology or the knowledge on the saliva testing. We're here to work with you. We're here to help you to improve your patient outcomes. So we do have an open door policy.